This is Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. I'm a psychiatrist practicing in Massachusetts. And this is a podcast that's about everything related to mental wellness in the Black community and beyond. One of the questions that comes up regularly by patients during medication discussions is there a natural alternative? The world of complementary and alternative medicine can be difficult to navigate, but my guest for the podcast today is here to help. I'm going to add her to the podcast now. Dr. Tiffany Smith is a doctoral level psychiatric nurse practitioner who turned to functional medicine and nutrition to create a holistic approach to healing after helping her combat veteran husband recover from debilitating pain, PTSD, and other conditions. Dr. Smith founded Aroma Functional Nutrition, where she helps her patients identify the root cause of their conditions and creates a customized treatment plan that incorporates lifestyle changes, counseling, coaching, and natural supplements. Dr. Smith sees mental health care as about more than just medication. She created the Mental Health Resuscitation Program, a community with mental health resources, and she hosts webinars, trains in perinatal mental health care, and hopes to start a podcast related to complementary and alternative medicine. Welcome to the podcast, Dr. Smith.
Hello, and thank you for having me.
So how long have you been practicing, and do you see adults or kids?
Okay, so I'm a nurse practitioner, so my journey begins as a nurse. So we go way back. I started nursing school in 93, graduated in 96. And so all of that bedside, right there with the patient, in their lowest moments up to now has fed me into being the psychiatric nurse practitioner. I attended Gonzaga University just about 4 to 5 years ago and have my functional medicine practice. And I treat primarily adults. And for me with the kids, I'm afraid that it's going to tug on my heart a little bit too much and may lead more to burnout because they're the precious babies. So my approach is to address the parents, to address the adults, because then that's going to trickle down into the family. Yeah. And that's my approach, because I love the babies, but it's hard to see them hurt. You know, it's hard. And I've had to deal with some kids, but it's challenging. So I try to treat the adults to help trickle into the families, the matriarchs primarily of the family.
And tell us a story of your experience with mainstream medical and psychiatric practice and how you transitioned to developing an expertise in functional medicine and nutrition.
Wow. So, it starts with my husband because he had a lot. When you have that chronic pain, it also brings with it depression and anxiety. You're not living your life as you want to, sleep disturbances. And he said, I don't want any more of this Western healthcare. Forget about it. It's invasive. We're not increasing our quality of life. And so we just had to open ourselves up to find something that was going to be more holistic. First thing I was introduced to was aromatherapy. And when I was introduced to it, no one could really explain how it worked. What are the contraindications? What's the proper usage of it? So I went to school to become an aromatherapist and got a degree. And in that time, I created blends that helped him. And then he started getting up and moving in life. So the next thing is, how do we keep you up? And that's where we moved into lifestyle and functional medicine. And I got advanced education in that. And so in my practice, I started to see parallels of what I had gone through and was working through in my clients. And I said, I need to create a practice that is going to encompass all of these holistic modalities and offer it to patients. Because patients tell me they've been sitting in the car just kind of crying and having a panic attack because before even coming in. And that's why you get no-shows, is it's so much. Because you're at this point in your life, and when you have to go see a provider for it, you kind of feel like you're at rock bottom. Yeah. And I want to offer more support, more love around that, and let people know that it's what you're feeling is okay, and you're not broken. We can help and you can be better. So I wanted to give some of that love and support. Also, I got into maternal mental health because my client came in and said, I don't want to be on any more medications. I'm pregnant. Okay. Let's not just stop right away. Let's create a plan and work through that. And in that, I realized how, I had to reflect on my own journey as a mom and the emotions that I went through and how you want to do everything for your baby, but then also the increased risks as Black moms, number one, but two, just as a mom and the emotions you go through, and that there needed to be more specifically trained providers in that area. So my functional medicine education also approached the maternal mental health, and I engaged more in that area. And then another thing was with the LGBTQIA plus community. I had a trans male come into the office, and they were looking all around the office. And at the end of that, I came to understand that they were looking for those signs of it being a safe place. And so I did my doctoral project on that community in educating and bringing more cultural competency for that population. So it's just wanting to be there and care and support these communities that is the impetus for me to be here today and bring this sort of a practice and education. I want to empower people to know that you have a lot of control when it comes to your mental health and well-being. Mental health is everything, and everything is mental health.
Yeah, it sounds like you provide a lot of validation, for folks who are feeling invalidated by the world, but also by their medical providers.
Yeah. And that's on my website. First thing it says is you deserve to be seen and heard. And that's the number one thing I hear from people. And it happens to me. I went to the doctor and I'm like, hey, I keep getting these shortness of breath when I'm driving to work. And he's like, you have anxiety. No, I do not have anxiety. And it was just saying over and over again, I'm having this issue and it is not anxiety. Okay, but help me think, let's think together and figure this thing out. So yes, being seen and heard is one of the biggest challenges in our healthcare community, and primarily for our African-American community or people of color in general.
Yeah. Wow. So tell us a little bit more about how your approach might be different from the traditional evaluation that people might receive when they go for an appointment.
Yeah. So with psychiatry, we're primarily going to be meds and counseling. That's what most people, it's meds and counseling. But mental health is so much more than that. And in our psychiatry, we jump straight to the brain, right? There's an imbalance in your brain. But when we realize, okay, maybe you have depression, maybe you have anxiety, the question that comes after that is why? Why do you have these symptoms? I mean, what is the root cause to this? And first, before we jump to the brain, we should be looking at the body and the circumstances, because maybe it is that there's some genetic issues that we need to help circumvent. So your body gets what it needs so that the symptom of anxiety and panic attacks is not there. And now you're more resilient when things come. So we're looking at gut health. We're looking at detoxification. We're looking at all of the precursors to your neurotransmitters and finding where on a functional level, a functional medicine level, how to support your mental health care. Now, medications have their place. It's not anti-medication, but it's proper usage of medication. And we find today that we're leaning very heavily on medication. I just want that quick fix. But we actually have so much control, and it's all in how we live our lives. So in meeting with me, I have a DNA test, and I have the gut tests, and I have the brain neurotransmitter tests, and these different tests that helps me understand what's really going on with you. But we take a look at how are you presenting? The DNA test is a given. It happens because that's your genetics. It's going to be. But you tell me your circumstance, and then we'll put together the right piece and treatment plan that works for you. So I'm integrative and functional. And what that means is I'll integrate. Like I used aromatherapy, but maybe yoga's your jam. Maybe it's Reiki, maybe it's massage therapy, maybe it's this, maybe it's that. And we bring together that treatment plan that fits you. So you're going to get a customized and personalized treatment plan that is going to be the most holistic, least adverse, risk adverse for you to help you get where you need to be. And sometimes it's the simplest things. So you may come to me and I'm not writing a prescription at all. It's going to be certain. It's like when you have a thorn in your finger and you pull that thorn out, now you're better. So sometimes it's identifying those thorns and removing them, and the patient is better. And no longer do they feel like they're going crazy, for a lack of a better word.
That sounds like there's a lot of things. I mean, do you have a team of people helping you, or?
My success is really being authentic and connecting with the person. So I remove my own bias as much as I can. I remove me out of the way, and I really listen to the person. And that person is going to guide me into how to guide them. And so that's where the power is. So I don't believe in anyone being in a box. I believe that everyone has their own individualized, personalized, biochemical individuality. And I'm just helping you be the best you can be and get back to you, whatever that means for you.
And I think, and in order to be able to do that, it sounds like you are trained in multiple kinds of modalities. So in that way, when they come, you can discern that treatment plan they need, and you have the ability to provide any of those, things that you've offered them, right? And that's why I kind of joke and say, "Do you have a team of people?" Because it's basically you're off. There's so many things that you can offer based on the knowledge that you have, and it's not very many people that have kind of such a wide array of skills, to be able to offer that to their clients.
Yes, and it does require partnership and teams, and bringing in, for example, I may need to bring in the counselor. I may need to bring in a functional medicine PCP, or just be working with the PCP. So it is always a team effort where we're all working together.
So what are some of the top issues that the people come to you? What do they tend to be struggling with, mostly?
Living life. It is just maneuvering through life, and it being so stressful that you get stuck, and you don't know where to go. So even, for example, something as simple as you're trying to do the best you can for your health, and you do take the pill. So let's say you take an antidepressant, but you're still having lack of motivation, lack of energy. You may still be having symptoms. So it's like, so now you go to Dr. Google and you're trying to address these individual symptoms, but you don't have a place where you can just kind of get it all taken care of, right? Because that doctor did this provider does that, and it's very fragmented. And so what I try to do is bring it all together for the individual. But the biggest thing, that's one thing, but the big thing is that it's life. And when I listen and I connect with them, I'm hearing it's relationships, it's the job. It's you've lost yourself just in this whole big distracting world that we live in. And that's why I say I don't always write prescriptions. It's oftentimes just helping people get back to who they are. And so I can help to identify. And I think you even spoke to this in your podcast episode about why you do and don't go to a therapist. And so I highlight a lot of those things, being that objective person, giving that feedback. And when we talk it out, they're better. And I give them tools and techniques to work through and ways to look at things, and now they're able to move forward. So that's the biggest thing. And so I really highlight community as being important. And I love the points that you made in regards to why you need a therapist too, not just the family.
Well, thank you. Thank you for listening to that episode.
Yes.
So on your website, you kind of mentioned that in mainstream medical practice, the focus tends to be on treating symptoms with medications, and then they prescribe more medications to treat the side effects of those medications rather than addressing the root causes. You kind of started talking about this a little bit. What are some examples of like root causes that you've helped people to kind of discover were going on?
Mold was a huge one. I had a client, and this was in traditional psychiatry. She was being seen, and I was transitioning, and I'm like, you just keep getting worse. And the modality is you increase the dose, you add a new med, or you switch to something new. And I said, we need to do some functional testing to find out what's really going on. She was off the charts with mold. And so
Wow.
she ended up relocating, moving out of state, so that she can be in a healthier, cleaner environment. So
Hmm.
mold was one big issue. A lot of times it's the gut and detoxing. And you don't think about these things. You may say, I'm anxious, I can't focus, I can't sleep. But the other part B of that is I have gas, I'm bloated, I'm constipated. That all goes together. And so when we put it all together and we can address the gut, remember, most of you probably have heard of the gut brain connection. Most of your serotonin is in the gut. That's going to help you sleep. That'll help you be calm. That will help you be happy when we address your gut health. When you're not moving your bowels, you're holding on to toxins in your body. It inflames the body, it inflames the brain. Now you are having depression symptoms, anxiety, even psychosis. So if we address the root cause and really get to what's going on in the body and the mind, so my recent lab work that I looked at, my client says, okay, I have ADHD, things are getting really bad for me. And in the testing, no mental health issues, it's gut and detox. So we have to look at not just going straight for the brain, but what's going on in our life and in our body, and then the brain may not be the issue. It is just your diagnosis can be a symptom to the root cause. So we don't stop at the diagnosis in functional medicine. You have anxiety. Okay, why? And then we'll find those other reasons why.
Oh, so it's like sounds like a kind of a comprehensive kind of screening. I mean, depending on what the person needs, you have the ability to order
Right.
these kind of certain lab tests.
Yeah, and even if you didn't order all the lab tests and just put in certain lifestyle things, you can allow your body to heal. It's not as quick as a drug, but no side effects either. It just takes time, and so you got to put your body in a place where it can have what it needs to heal and do what it needs to do. And so identifying even those deficits. So if it was someone in a lower income status, I can give a lot of lifestyle recommendations that I know can help. So, taking more green leafy vegetables, cruciferous vegetables, for example, and understanding the impact that has on them. If they do that, we might not even need to get any testing. You can still be better. So everybody's different, and I try to meet them where they are, depending on their journey and the level of disruption that this caused in their life.
Of the lifestyle changes that you might recommend to people, there's food, particular as a lifestyle change. There may be certain kind of behaviors. What are some of the top kind of lifestyle changes that you might recommend?
Yeah, the top one is sleep. We must sleep. That allows us to process our traumas, our thoughts, our memories, and rejuvenate our body. So getting a good quality sleep can be your very first step. The next step would be nutrition, what you're putting in your body, because it can create inflammation in the body and exacerbate a lot of mental health conditions. And then the third, stress. You got to manage your stress. The stress is going to decrease your serotonin, your thyroid hormones, and it's going to produce those symptoms of depression and anxiety because you're shifting your hormones and the transmitters, and it's all getting out of whack. So managing your stress, if that means just taking some time for you, is going to help you self-regulate and help your hormones regulate very naturally. So then movement. Movement is so regenerative to the body, not going out and, doing 1,000 push-ups and chin-ups and all of that, but whatever movement feels right for you is what you should do. It's very nurturing to the brain. It's very detoxing. Sweating is detoxing. So getting a good sweat on will help you release things that can hold you back as far as causing inflammation in the body. And a good support system, having people around you that you love. And when I talk about, now these things are common. We know a lot, we hear a lot about these things, but everything is connected. So when you look around you in your environment, what color are your walls? What do you have in that room that makes you happy? You know, are your PJs warm and fuzzy and cozy? You know, is the temperature of your room at night nice and warm? You love who you sleeping with, you know? You know, who you're spending time with. Do they build you or do they break you? Get rid of those things that do not serve you. So your mental health comes down to the very finest, smallest things. A small thing, like for me, is like I like to have a parsley or cilantro in my eggs. I like to see the green and the yellow, you know, and so put it on my eggs. It makes me happy. You know, something as simple as that. So identify those things, just ways, little bitty ways you can start to add a little bit more joy in your life. As simple as putting a pink charm on your keychain because pink is a very comforting color to you. These are those small things you can do to bring you happiness. And that's how mental health is everything. And everything is mental health.
Wow. I mean, those are just things that people, I can imagine, you know, sometimes people don't allow themselves these smaller joys. And sometimes, you know, meeting with someone and talking with someone like you almost gives them permission in a sense to kind of like allow themselves these little joys, like just paying attention to what is it that brings you small pleasures and kind of incorporate those things into your day. Because sometimes we're looking for the big things, that big vacation. And it's like, well, no, what about, do you like just kind of stepping outside your house when you have coffee in the morning just to let the sun hit your face? You know, something as small as that.
Yes.
So I wanted to ask about the, when you do the kind of counseling in the customized treatment plan, you have the lifestyle changes, counseling, coaching, natural supplements. When you do the counseling, are you using a specific kind of psychotherapeutic approach, or is it kind of like eclectic where it's like different approaches? What is your kind of strategy?
It's the intuitive approach. It is really listening to them and giving them back what they're presenting to me. So if we're talking about a particular topic, I'm hearing the tone of your voice. I'm hearing the energy around what you're saying. I'm feeling what you're feeling. And in that, I can identify. So you don't have to tell me everything. We can talk about something really simple, but I could identify, oh, it's that relationship. Oh, it's work. Oh, you really love this, but you can't dive into it because this is blocking you. And so it's about that active listening and really being present and connecting with the person, hearing everything that is not being said. So I call it an intuitive approach. And an authentic approach, being a human being to a human being. You know, I'm not thinking, okay, CBT, DBT, motivational interviewing. You know, I'm thinking, okay, what's important to you and what is going to make you happy? What is going to help you be the best you can be? And you're going to tell me, because it's just what we do. You're going to tell me what I need, and I have to sit. The thing is, I can't control it. You know, we want to control things. I can't control it. So I release control. And I listen and understand that person. And then I tell them what they told me. And then I'll be like, I didn't even know that. I didn't even think about that, you know.
Because it's a perspective shift, you know, when you kind of take what they told you, but maybe you ask them a question that makes them think differently, or you reframe it or rephrase it. It can create kind of revelation in that way.
They might not realize something is a bugaboo for them, you know.
Because you're helping them connect the dots.
Right. Yeah. So an intuitive way. I did want to say that I do find you talk about allowing people to like give them permission. I find that people do. That is something people do need. And so I try, and every time I speak and anything that I do, I want to give permission. I want you to know it's okay to love yourself. I want you to know it's okay to be you. It's okay. You know, I had reservations, and I've realized more about how culturally there's certain holdbacks, and how I didn't want to wear my braids, you know, because I didn't want to be, you know, it's not something that was at that time main society. Now you see more braids and it's accepted as our culture, but it was very hard for me to wear my braids in the professional sector, because so it's like, now that we say we have a culture, I feel so nurtured in allowing my natural culture to come forth. So in that way, I was given permission to wear my braids, to wear anything that I felt was part of me, and so I've also found that that other people need that too. And so I try in every way to let people know to let that go, get that off your shoulders, and you're okay.
No, it makes sense because, sometimes I think growing up, so both childhood and in young adulthood and so on, there's different things that we pick up. We learn it's not okay to do this. It's not okay to do that. Or my feelings are not welcome here. Or
Right.
it's not okay to cry. Or,
Yeah.
it's not okay to show weakness. There's like these little things we pick up, sometimes because they're said explicitly by a parent, but sometimes it's implicit, that when you do or say these things, people respond poorly. So you learn, oh, I need to hold back. And
Right.
so hearing from a professional, go ahead and cry, release those tears. It might be the first time for some people that they've ever received permission from someone, an authority like you, to kind of say, that's okay.
Yeah.
It's okay.
Yes. And I try to give as much permission as possible. I do, because I came to that revelation as well. Yeah. And it just touches my heart.
No, it changes lives because sometimes you are the first person that they've gotten, and they'll respect that coming from you. Kind of hearing that it's okay to be vulnerable.
Yes. Because that's a big one, being vulnerable. That's a sign of weakness. Yeah.
So I wanted to ask kind of a practical question. In your customized treatment plan, you also talk with folks about natural supplements.
Yeah.
And I know there's a lot to be said about natural supplements, but one thing that came to mind was insurance companies don't always pay for them. They're not always on their tier plan system. So people are often paying for natural supplements out of pocket, particularly because there's different brands, and some brands are higher quality, and
Right.
it's just not going to go through your insurance most often. So is there an economic burden for the natural supplements, even some of these tests that are being ordered? What is that like for folks?
Yeah, definitely. But there are some things that some insurance companies will pay for. I do use some medical foods. There's like some fish oils, but your multivitamins and things like that. No, not as much. So what I do is I emphasize the food and eating more nutrient dense foods. And then with the testing, it's like, okay, if I understand the process. I understand that, okay, what I'm hearing is probably what we need to do is you need more B vitamins. So I'm going to, make sure nutrition wise, you're getting more of those B vitamins. And, I know how to shop economically. We can have a conversation on how to shop economically, how to, make it work, what to buy organic and not organic, and things like that to help guide my clients. So yes, this stuff is expensive. The tests, supplements can be very pricey, but you also don't want to get crappy supplements as well, the cheap things. So it's hard to discern sometimes what's good and bad in that. But if we get down to basics and we just be more selective in what we put into our bodies, and then we make sure that we're resting and we're not stressing, our bodies can utilize more of that. But I do have a really good medical food that I use that is approved through insurance that can help a lot with our mental health in particular. So I leverage what I can through the insurance, but it is an economic burden. So there's a lot, because there's lots of providers that are functional medicine that were not in position to do testing. So they just gave some lifestyle strategies, and then the patients got better. just by utilizing lifestyle strategies. So there's we don't take advantage enough of the control that we have in our lives. And so I really, really push lifestyle. You got this.
And it sounds then that, people shouldn't be discouraged from kind of looking for holistic providers if they're worried about cost, that things can be customized for what they can afford, and that some things can be low or no cost depending on what the intervention is.
Right. Correct. And it's about the desire of the person. We make financial decisions for a lot of different things that we may or may not need. And so really, what is the why for you wanting to be better? And when you have that why, you'll do anything to make sure you're okay. So when you have kids, they're your why. And so you want to make sure you're okay and the best you can be so that you're there for your kids. So sometimes you will find a way and make a way in some scenarios to make it happen. And then sometimes it just can't be, and you can utilize other ways to find the solutions. But there are solutions. Remember, just keeping it as basic as possible and looking at the basic things you do and how can you shift to make it better. Can you pay $2 more per package or for a better quality of meat than this? But focus on those fruits and veggies. That's all.
And when they change their diet, if they have children, that will, as you mentioned, kind of trickle down to the family, because now they're buying these more nutritious foods and everybody's going to have that for dinner.
Exactly. And it helps the whole family. So whatever stage everybody is in, everybody gets better. And then also the deficiencies that mom may have, the kids will probably have because they're eating the same thing. So everybody's health will improve for the better. And so even with our low economic and SNAP, with and everything with the food stamps and whatnot, making better choices and how to stretch that dollar is a great education, because you can eat really, really well.
Because it does cover certain kinds of vegetables, whether they're maybe frozen veg or canned or whatever, it does
fresh.
cover.
Yeah.
And fresh as well. Yeah.
Yeah. So it's just also making choices, getting the knowledge to make better choices. I think I'm going to create more products around this.
Yeah, because there's a lot of need for people to know what to buy and like how to use nutrition, and there might just be simple tips that can be used, or even resources, books that you can borrow from the library and read on it. So I wanted to kind of like circle back to the Black community, as my podcast about Black mental health. And I want you to talk a little bit about how the holistic approach that you use may be a good fit for folks in the Black community.
I think it's an excellent fit in our community, primarily because we are resistant to seeking healthcare. When I say I'm a psychiatric nurse practitioner, everybody backs up. They give me space. They turn around. I don't need that, So there's still stigma around seeking mental health care. I hate to say that the majority of my clients are not Black because of the stigma, because of what someone might think. And so understanding what you can do for yourself, I think, is so empowering when you are that type of person. And even myself, I'm withhold from the healthcare system because I want to make sure I've done everything I can. And I also have fear of entering the healthcare system because it's not about status. It's not about the credentials in our name. We still fall under the same statistics for our people of color. And so understanding ways you can help yourself, I think is so powerful for our community, because we will wait and put off to go seek care. And so if you're eating the vegetables and you're exercising and you're sleeping, you are doing so much for every organ and every part of your body that's going to be beneficial. If something's wrong, you need to seek care. But prevention, knowing these lifestyle strategies, I think is just huge to help, and understanding that it's okay, starting to recognize when maybe you're holding on to some baggage, when some things may be more generational trauma that you don't even realize you're doing, and being open to some of that. I love that we have so much communication, podcasts and YouTube, because you can learn so much. And so I feel that helps us as a community to learn and to implement and try to put things in place for ourselves. We are doers. And so to have the knowledge, we will do, versus not having the knowledge before.
And one thing that I like about what you're doing and how it's a great fit for the Black community is the customized treatment plan, because I feel like one of the top things that folks in the Black community face is this sense of not, as you mentioned, not being seen and not being heard.
Yeah.
Sometimes we describe things differently. We use different words to describe depression, different words to describe anxiety. And that root cause might be something different too. Sometimes, as you mentioned, the root cause is mold or the root cause is whatever. And it's like getting to that root cause. Sometimes people kind of make a lot of assumptions that everybody has the same root causes and they may not dig deeper. Right. And so I like that. I like that you do that in your work. And I feel like that's really important and necessary in the Black community. Somebody that's going to go deeper and say, let's take a look at this and that, and not just assume that you're going to respond to an antidepressant for depression.
Right. No algorithm here. Yeah. Exactly. No templates, no box. It's all about you. Yeah. Yes. I agree 100%. Being seen and being heard.
Now, thanks for coming on the podcast today. I want to ask as one final question, just any tips for a listening audience on simple ways that they can support their own mental wellness at home?
First thing is, you got to make sure that you're not so distracted and stressed that you can't hear yourself, your intuition, the Holy Spirit, God, whatever you want to call that voice inside of you, because you have the answers, you have the strength, you have the knowledge, you have made it this far in your life successfully. So you got it. Now, it's just that we have in our world these distractions and things that try to take from us. And I want you to guard yourself, guard your emotions and what you let in, and get rid of those things that no longer serve you. So be able to listen to yourself and trust what you hear is true and follow that through. If that relationship isn't working, you're feeling that for a reason. If the job isn't a good fit, you're feeling that. It's going to create, when you have this disruption in your body, you know that something isn't good, but you stay there anyway, that exacerbates and causes the anxiety, the depression, and the issues, because you're going against what you really in your heart know is true. So really trust yourself and follow your gut. Second thing, start to track yourself. We all have smartwatches and phones and things and devices. We got stuff. Pull it out if you're not using it, or use it more effectively. So you're learning, what is your resting heart rate? How well did you sleep last night? What is your oxygenation levels? Start to understand these foods, they kind of make me jittery. So coffee can make me jittery after I drink coffee. This food helps me feel stable and pretty level most of the day. Start to learn yourself, because if you do need to engage in the healthcare environment, you can provide data about you, and that helps get a better treatment and result. If you can say, this is how I am, this is what's been going on lately, and I'm not sure what's happening. And that'll help providers to give you better care. But if we go in and just say, I'm hurting, find out why, we leave the control to them, and it could go any kind of way. So track yourself, listen to the voice, spend time loving yourself. So it all begins with you. And that's what I'm trying to say. And so one of the things that I want to offer your listeners is this 21-day Love Thyself journey that is, all you have to do is text self-love as a compound word to 702-919-4249. And it's just going to give you just gentle tips and reminders and thoughts around how to love yourself and care for yourself. And even if you do, it just reinforces what you already do to help you be the best you can be. So those are the main thing is getting back to you and who you are and loving yourself, because then that's going to portray you forward into the world.
Awesome. Awesome. And I'm glad that you have something to offer too. That's really great. You have a gift for our listening audience. So, where can people find you online?
Instagram. I'm trying to build up my followers. So it is Dr. Tiffany M. Smith. And it's under my name here at Dr. M. Smith. Everything is Dr. Tiffany M. Smith on Facebook and LinkedIn as well. And so that's where you'll find me.
All right. Well, thanks for coming on the show. Thanks for you listeners who've been listening. You've been listening to Black Mental Health Matters with Dr. Kerry-Ann. My guest today was Dr. Tiffany Smith. And we spoke a little bit about holistic medicine, natural functional medicine and nutrition, and how that intersects with mental health and with the Black community. So thanks for listening, and I will talk with you again next time.